Bom, boa tarde a todos e todas. Agradeço muito a presença de todos os colegas aqui no Anfiteatro Mariana Fernandes, na data de hoje, dia 2 de julho, especialmente os colegas da pós-graduação, estudantes, tais, e também agradeço a presença de todos que estão nos acompanhando pelo YouTube, né, então pelo canal da Escola Paulista de Enfermagem. Hoje nós temos a honra de ter uma reunião científica de uma temática extremamente importante, com um convidado estrangeiro, né, então com um convidado muito especial, que vai falar sobre o tema Global Health and Policy Research. Então, é o professor Amos Channon, é isso? Amos Channon, yes, da University of Southampton, UK, yes. É professor de saúde global e demografia do Departamento de Ciências Sociais e Demografia da Universidade de Southampton. E antes de nós darmos início, eu gostaria de passar a palavra para a professora Aridiane Alves Ribeiro, que falará um pouquinho, contextualizará um pouco para a gente sobre a visita do professor aqui no Brasil. Thank you so much.
Boa tarde a todas as pessoas presentes e online. E a gente... Então, será que está ok o som? Também acho que não precisa falar muito alto. Eu gostaria apenas de contextualizar o motivo da visita do professor Amos ao Brasil. E aí eu vou misturando um pouquinho da língua. Eu gostaria só de fazer uma apresentação breve sobre a pesquisa que nós estamos realizando conjuntamente desde 2018, que é a pesquisa Eu Quero. Será que eu consigo andar com esse microfone e esse fio, sem fazer nenhum acidente? Tá, obrigada. Só um minuto. Como é que... Bom, preciso ficar posicionado em algum lugar por conta da videoconferência? Precisa? Ok. Sim. Então, a pesquisa Eu Quero é uma pesquisa financiada pela Fundação de Amparo à Pesquisa do Estado de Goiás, pelo Medical Research Council, é aquela apresentação mesmo, pelo Medical Research Council do Reino Unido e pela Fundação de Amparo à Pesquisa do Estado do Maranhão, porque nós somos um estudo multicêntrico realizado pela Universidade Federal de Jataí, em Goiás, pela Universidade Federal de Goiás e pela Universidade Federal do Maranhão e Universidade de Southampton, de onde Amos fala. E aí acho que se eu puder andar até aqui, eu acho melhor para poder passar a apresentação. Então, é uma pesquisa que não é feita somente por algumas mãos. Então, essas aqui são as pessoas que fazem a pesquisa no estado de Goiás. Pode passar, por favor. Como eu já comentei, as instituições parceiras, pode passar, por favor. E por que eu quero, né? É uma pesquisa que foi submetida ao edital em conjunto com a CONFAP, que é a Confederação Nacional das Fundações de Amparo à Pesquisa, e um edital conjunto com o Medical Research Council, e nós temos esse acrônimo Eu Quero pelo título em inglês, que é Engaging Users for Quality Enhancement and Rights, Strengthening the Maternal and Child Health Care System over the First Thousand Brasil. Que quer dizer como que a gente melhora o controle social no SUS a partir do trabalho de educação e informação de profissionais na área da saúde, que podem atuar como multiplicadores junto às pessoas que eles atendem, no caso, mulheres e mães de criança até 2 anos. Pode ir para frente, por favor. Aí a questão dos 1000 dias, que é desde a concepção até parto, pré-natal, parto, pós-natal e a saúde da criança até 2 anos de vida. E eu só gostaria de salientar aqui que essa é um sumário executivo que nós fizemos de como a gente construiu esse material educativo, né? Como que nós fizemos a co-construção de uma cartilha e um programa educativo junto com os trabalhadores e trabalhadoras. Então, é uma pesquisa que é situada junto com a comunidade, que empregou diversas técnicas de pesquisa, dentre elas o grupo focal, para entender como é que é a realidade, e a partir da realidade a gente construiu um material educativo que fizesse conversa e fizesse sentido especialmente para as pessoas envolvidas. E a gente, como produto, pode passar. Nós tivemos a cartilha, que trouxe falas e os assuntos que foram priorizados nesse material educativo foram escolhidos junto com os gestores e os trabalhadores de saúde de Jataí, né, do município de Jataí e outro município do estado de Goiás, também considerando o pessoal participante, né, do estudo no Maranhão. E a gente já distribuiu mais de 500 exemplares somente no estado de Goiás, e outros 500, pelo menos, serão distribuídos no estado do Maranhão. E esse é o material que foi base da pesquisa, o material educativo, e como é que foi o programa educativo que nós construímos. Se puder passar um pouquinho para frente. Enfim, pode passar esse slide também. Nós fizemos vários programas educativos a partir de metodologia utilizando design thinking, metodologias ágeis de validar e testar. Nós validamos pelo menos 2 possibilidades, presencial e online devido à pandemia, e chegamos na versão final de um programa educativo que nós implementamos e avaliamos depois, né? Isso tudo de 2018 a 2023, que foi o momento final agora da pesquisa, que nós fizemos a devolutiva para os gestores envolvidos de como esse programa educativo funcionou, as potencialidades e, claro, os desafios da implementação de uma formação em saúde que seja compromissada com a realidade, reflexiva e crítica ao mesmo tempo, para que a gente transforme juntos e juntas a realidade do trabalho em saúde. E aí, acho que são informações sobre o curso que a gente poderia passar, por favor. E aí, são mais informações sobre o curso, depois, em outro momento, seria mais pertinente comentar e compartilhar. Eu só gostaria de trazer alguns indicadores do curso que nós, né, desse programa educativo, em que nós tivemos 117 inscrições, das quais 95 pessoas, pelo menos, avançaram mais de 50% do curso, e dessas 53% delas finalizaram, e a gente teve um tempo de engajamento médio de 1 hora e 48 minutos, ou seja, as pessoas ficaram mais ou menos mais de 1 hora assistindo o material, o que representa engajamento e interesse das pessoas no material educativo online, e tivemos quase 100% de likes no material que foi produzido, né? Então, isso tudo foi utilizado como avaliação do material, por favor, e 80% dos participantes avaliaram os encontros presenciais como muito bom. Então, é um material que a gente levou esses dados para a Secretaria de Saúde do Estado. Pode passar para frente, por favor, mais um momentinho. Esse aqui é muito interessante, mas o que nos interessa comentar aqui é que nós fizemos uma parceria a partir das devolutivas que nós fizemos com a Secretaria de Estado de Goiás para a implementação deste programa educativo a nível estadual. E aí, foi neste contexto que Amos está fazendo essa visita aqui ao Brasil. Nós assinamos, pode ir para frente, por favor? Pode ir para frente. Nós assinamos o termo de convênio junto com a Secretaria de Estado e a Universidade de Goiás para a implementação e a transferência tecnológica educacional da universidade para o Estado, que significa bastante quando a gente pensa na perspectiva de avançar para além dos muros da universidade, e a Amos esteve presente para o lançamento desse programa educativo em dois momentos na Secretaria de Estado, que foi o lançamento oficial para os trabalhadores, e aqui em cima, na primeira foto, a gente consegue ver o secretário de Estado nos recebendo e formalizando este compromisso. Então, é nessa ideia que Amos está aqui também na Unifesp, nessa perspectiva de construirmos trabalhos semelhantes junto aqui com a Unifesp. Amos, então gostaria de passar a palavra para você para falar um pouquinho mais sobre Amos. I'd like to invite you to come here, please, to share about Southampton and so on. Thank you so much.
Thank you very much. I have just sent some new slides over. Sorry. New slides. Okay. So I've sent it to you now. Apologies. No, I've just sent some new ones. Sorry. Apologies. I've just changed them. Boa tarde. A todos e todas. Is it? Sorry. No, not that one. Not that. I sent the wrong slides. To start with. Yeah. It should be. Yeah, that's the one. Yeah. Perfect. Yes, that's good. Yep. Thank you. Obrigado. I can do that if you want. So, thank you very much for inviting me to speak to you today. I wanted to talk a bit about Southampton, but also about the approach that we take to conducting partnerships in other parts of the world. So lots of Southampton's research is with, is this all? Yeah. Lots of Southampton's research is with overseas universities. And I would like to think that we have been part of the agenda to make sure that it is a true partnership and not a fake partnership with that. And so I'm going to talk a bit about decolonization and about how we are decolonizing our agendas in Southampton as well. Aridiani thought that might be interesting to see our approach and about how we applied that approach in Okiro as well. So I'm from the University of Southampton. Just firstly, a bit about myself. So my title is Professor of Global Health and Demography. And mostly I look at maternal health and child health in low and middle income countries. And I don't like the term low and middle income countries. It is better than developing countries. It is better than other ways to describe, but it still is us and them. And in fact, we are all one big international community. I am also increasingly interested in looking at disability in resource-constrained situation. So where individuals and countries might not have the resources available that is needed. So it needs innovative methods to try and support people from disability, especially to do with mobility and to do with prosthetics as well, amputation and prosthetics. And I just wanted to, show, partly because I was interested in, seeing where I've worked around the world, and I've been very, very lucky to work in many places around the world as well. And I've listed some countries there that I have been involved with. And I have been very fortunate in the fact that I have been able to discuss ideas in all these places. And each of the places and countries that I've been, I have learned something new. And I hope that I have managed to help teach or inform in some way as well. So I'm happy to talk about these countries as well if you have any interest in research around them. I thought I'd put this up there in case Southampton is not the best known university or city in the UK. It is down in the south. The most famous part of Southampton was where the Titanic set sail from, okay? Which is probably not the best advert because it sank soon after. It is a big port. It's one of the biggest ports in the UK. Everyone says it's by the seaside. It is really not by the seaside. because it is up an estuary. And so if you want to come there to get nice beaches, please think again, because it really is not very nice, the beach there. But you can see we're quite close to London, and we go up to London all the time, and we have an airport as well. And just a bit about Southampton University. We're quite proud. We're part of a group of universities called the Russell Group University, which is the group of the best universities in the country. So Oxford, Cambridge, UCL, Manchester are all part of the Russell Group, and Southampton is as well. Apparently, we have over 160 years of experience. I did not know this until I was sent this slide. I know we have a long, the history really starts about 100 years ago, about the same time as here, it seems. We are ranked globally in the top 100 universities, and for our research, we're in the top 10% of the UK as well. Education, all these rankings, it just means nothing after a while. Southampton are very proud of their rankings, basically. And we have over 25,000 students in different areas, with an ambitious plan to grow to 33,000 in 8 years' time. Where we're going to put them is a different question, but that is the plan of our leaders. And just in case you wanted, I showed some of it this morning, apologies if you've seen this already, just so you can get a picture of where we're at. It's a typical city. On the bottom right, that is on our campus, the main campus. We have lots of green spaces, and the top right is our football team, which I do not support. So, because I'm not from Southampton. So, but that, you won't have heard of it. Wimbledon, not the tennis, not the tennis, not the tennis. I'm not even from there. Don't ask. That's a long conversation for a shoppy, a pint. And just, to say we're in an area that there are nice beaches down in Bournemouth. We're near a place called Winchester, which used to be the capital of Britain 800 years ago, and whatever Britain was then. The New Forest is a big national park, very close, and I think everybody knows Stonehenge. So I like that Southampton likes to say it's near Stonehenge. It's about 45 minutes away. It's not too close, but it's not too far away. Anyway, that's about it's for the UK. It's not close, so and that's 45 minutes if the traffic's not bad. So. And just to say that Southampton is multidisciplinary university. We cover most of the subjects. The Faculty of Arts and Humanities looks smaller, but under the School of Humanities, we have history, we have philosophy, we have languages, we have many different parts under there. It's a big school. So there are lots of links that can be made between groups. And one of the nice things about Southampton is that we do work across the faculties, which are at the top, the main organising groups. In a sense, we ignore the faculties and just work with whoever we want to work with. And there are very close groups. I have just been turned down for a project which included people from each of the different faculties. We try and have this multidisciplinary perspective. And I would encourage, if anybody has ideas which lie outside my own department, which lies in the School of Economic, Social and Political Sciences, if you're interested in engineering or psychology, we can make links, and we can develop research from that as well. And I'm quite happy to facilitate that too. Linking down to my department. My department is the Department of Social Statistics and Demography. And we focus around three things. Mainly, it is around how we collect information from individuals and what that says about those individuals with respect to their lives and their demography. And so we have global health, which is something that I am leading in the department. We have demography, and we have social statistics. Global health mainly focuses around maternal and child health. We also have people looking at HIV. We have people, myself, looking at disability. We have people drawing access to healthcare maps. We have someone looking at workforce, and all of those aspects and more, all of those aspects in low and middle income countries or more resource constrained countries. One of my problems with global health is global does not mean global. Global means low and middle income countries, which seems a bit wrong to me. Because so if you say I'm doing global health but studying the UK, no, you're not. You are studying health in the UK. But that's a debate for another time. Demography, we actually are the UK leaders in demography. We have the UK Centre for Population Change. We consult with our local National Statistics Agency, which are just down the road. And most of the people who work in official statistics and in the National Office of National Statistics were trained by us. And in fact, the last count, I think we trained the chief statisticians in 10 countries around the world who came through our degrees. So we've got a long history about demographics and official statistics and everything. And social statistics, that's where we learn how to do surveys and how to conduct rigorous investigations to make it representative of the population. And so they are very advanced statisticians. And as I said this morning, I do not understand what they do, but they look very impressive. They draw squiggles on whiteboards and, you know, talk a funny language. So, and I said the expertise. So these are just a few very recent projects, population size over time, who and where do people live. One of the groups that we are linked with works outside the department, but really in the department, has calculated where people live all over the world in 100-meter square areas. So we know the distribution and by age and sex on every part of the world. Whether it's correct or not is, you know, a more difficult matter, but we've got some estimates so we can look at use of services and health services through that. I was involved in the sort of studying displaced women and children from Venezuela and Central America. So that's Venezuelans to Colombia and to Brazil, and also people traveling from Honduras, El Salvador up to the American border. And we're trying to understand what that meant for sexual and reproductive health of adolescents. That's mainly quantitative, but incorporating other methods where needed. Okay, that was all about Southampton. I wanted just to do that, you know, quickly. I was asked to just say where we came from and what we did. And now I just wanted to talk about how we can ensure a true collaboration. And this is where I talk about the decolonialization and trying to ensure partnerships are true. And I believe, and many people believe, that development of research and development of new ideas is more productive if we collaborate. Collaborate between areas. I mentioned about the areas in Southampton that we collaborate, but also collaborate between countries and institutions, and between academic and non-academic areas. And that's between governmental agencies, NGOs, non-traditional academic areas that might have a different perspective to the universities. And historically, we've not been very good at this. Historically, there's been a lack of this because of, universities and certain researchers not caring. They do not want to collaborate because they know best. There has been a change, but it's still lots of work to do to try and make things a real partnership. We like to think that we collaborate internationally because, I say, the advances that you can make are far better if the research is embedded in the country that we are researching. Just like if someone was researching the UK, we would like them to talk to the people who know the country. That hasn't happened the other way sometimes. So we allow ideas to be shared by joining together. And I use this example about my research in Brazil for the Oqueiro project that Aridiani has just mentioned. When I first came in 2018, I didn't know much about the research that's been conducted already. And Aridiani and other collaborators will say, yes, we'll follow the works of Paulo Freire. Apologies for the mispronunciation of his name. Freire? I'm not going to be able to say that. Freire. Okay, that'll do. So, apologies to Paulo. And I was there going, well, obviously it's very important, but I've never heard of this man or this tradition. Because his teachings had not reached my area, or basically had not reached the UK, as much. But I know it's such a strong tradition because of the, background and because of politics, the political persuasion in Brazil. It's really important. And so obviously we've taken, and lots of the project is based on this collaboration, this listening, this sharing of information that's there. And that demonstrates about the tradition that Brazil has in research and collaboration and listening within the country. And that was my problem. It's not anyone else's problem that I hadn't heard. And so, as I say, we incorporated the ideas into what we did. And indicating that, a simple example about co-learning. And it wasn't just one way. And so that can help me conduct research elsewhere. So that led me, alongside decolonization. And this is a movement that's happened over the last 10 years, but really getting going now about equity and in collaboration and being sensitive to what we are doing. It comes as no surprise that the UK is not been great about colonization in the past. I say that with my tongue in my cheek. Obviously, we've got a poor history of colonization. And it's something that, as a country, we have not engaged with fully yet. I was asked, I can't remember here or elsewhere, we don't actually teach colonization in our schools. Maybe it's too embarrassing, maybe it's too scary, but actually I don't know anything about colonization from school. It's just what I've picked up, which is amazing given it's such a big part of our history. But the ideas of colonization, even though most colonies stopped 50, 60 years ago, there is still the mentality of we know best. And that's not just in the UK, that's in Europe and the US and Australia, you know, the lands where colonized, I know Australia and America is different, but the high income, the north, yeah, global north, yes, yes. And obviously it's not true. And the history of colonization is not just of countries, it is of ideas as well. And leading ideas through, through the prism, through our eyes of the global north, not understanding the situation that we're in. Researchers come over to developing countries, which is a word I hate because all countries are developing. And it is very, we developed, you developing. You know, it is not a good dichotomy, and not actually talking. So, and there's also the fact that in some countries, not Brazil, the history of formal academic, you know, inquiry isn't that long. Universities have been there, but usually staffed with people from the global north who have come down. I'm thinking about Africa. In some countries in Africa, the institutions have been very, very white until fairly recently. And there's huge issues with power structures. Who owns the knowledge? Who decides about what is published? It is interesting that lots of the research in Brazil is not known that much because it's published within Brazil, which is great, but does it count as knowledge if it's not published in a global north journal? And that's a question that is being debated as a lot. If it's not published in English, it is not seen as widely. You know all this. You know, the power structures, the global north does still control. So we do need to challenge the European-led research methods that are used by listening to local knowledge and by not ignoring the marginalized groups. So at the moment, we don't still listen to local knowledge and we do ignore marginalization. But what do we mean by marginalization? And that should matter to the country that we're in. And really, decolonization is to ensure that we do not recreate the mistakes that we've made in the past. And we should be equal partners. Too many projects, and I know we've discussed projects this morning, and I hope it doesn't go like this. It is, okay, so I'll be thinking, I'm going to get some money. Oh, I need a partner in Brazil. Okay, we'll put their name on it. They won't do anything, and I will decide it. And there's so many projects that still are like that now. And obviously that is, you know, missing out a huge amount of people who can, you know, further research and academic inquiry a lot. So we need to be working together and listening to the needs and requirements of partners and understanding through the local context, in a global context as well. So what does happening in Brazil, in Sao Paulo, mean to theory around the world? And that's what we can work together on. So we are stronger if we work across divides. So OKIRO is part of this. I would say it's a process rather than the end, but it was funded both by Brazil and the UK, the Medical Research Council in the UK and CONFAP in Brazil. And the development of the call for proposals was jointly done. So it's done in the right way. It was voices from Brazil, voices from the UK to come together to try and develop what they wanted out of this. And there was a workshop that I did not turn up to, but Aridiani did in Brasilia, to bring together people to have that discussion. So it would not be just a UK person saying, this is what I want to research, and can you join me? So there was the discussion. Hopefully it was a good discussion when you were there with my partner, Pierre Rigorozzi, who's from Argentina, but works in Southampton. And so the production of research questions happened between academic, policy, and the implementation communities. We wanted just to have some information to strengthen the health system and improve health outcomes and inform interventions which are evidence-based. And hopefully Ariadne has just demonstrated that. But we needed to demonstrate a clear and strong rationale for how the proposed network and research meets the criteria for world-class and cutting-edge policy-relevant research. So even though it is based in Brazil, it is supposed to be world-class. And of course, that is what you do generally, but it would be, it's a partnership to ensure that the voices and the research is heard. So that's where the research team came together from Goiás or Jetaí. At the start, it was the Federal University of Goiás, and then became the Federal University of Jetaí, and Maranhão as well. And these are the ideas that we came up with, which I won't go through because Ariadne has just, basically said these. But hopefully, from the start, this was a partnership, not a dictatorship. And one of the things that we made a part about in our application was that we were focusing on Brazil because the information that we get from Brazil is applicable elsewhere. Obviously, it's applicable in the UK. And one thing that the UK is not very good at is learning from other countries and saying, well, actually, what can Brazil or other countries tell us? And the SUS and the NHS should be very similar. You've got a much bigger private sector, even though our private sector is getting bigger and bigger because the NHS is failing. And so hopefully we can learn what works here and implement it in the UK as well. And what we learn generally about maternal and child health is applicable worldwide. There is this long history between the UK and Brazil, so we can build on those links. And I hope that this visit here is the start of collaboration with Unifesp as well. So we can build on those links too. And to get people the recognition that it deserves, which is why Ariadne and myself are sitting down tomorrow to write publications, aren't we, Ariadne? Yes. The work actually was led. I would not say that I led it at all. It was led by Ariadne in Jetaí and collaborators up at the Federal University of Maranhão as well. I was, hopefully helpful, but it was definitely led here. There was different approaches, which goes back to the decolonization agenda as well, that things are more appropriate in different places, even within Brazil. Obviously, Brazilian states are very different, and it needs to be appropriate for there. And we did use the work of Paulo Freire, to listen to those who knew best, doctors, nurses. We listened to agentes comunitários de saúde and mulheres e filhos. Crianças. And just to say that this is not just words, I wanted just to say about the work of, I'm not going to say his name again because I will do it, but I went to Nepal 2 months ago, and we were doing a stakeholder engagement, so listening to people with disabilities in a rural area in Nepal. And we relied on the work that I'd learnt here to apply into Nepal, so listening and co-learning. And I found it interesting that that's how research should work. You know, I know it's only myself, but that there's this chain that we can learn from. And it worked very, very well. We've got some really interesting ideas out of it, which were not the ideas that we thought we were going to get. So, decolonization obviously is not just about research, it's about all aspects of academia. And we need to engage all aspects of academia in that change. And that needs to be both in the UK, but also in Brazil, in every part of the world, to understand what the aim of academia is, and who we listen to and who we learn from. In teaching, for example, our curriculum has historically been decided by male and white people in the past. Have we moved on from there? Has the agendas basically been linked to a modern way of looking at people? And are we including the voices of the more marginalized? So what do we teach? Who do we teach about? Are we teaching about the references that have been published? The white, northern, global north researchers that have limited applicability here? Are there better voices to teach about? I don't know here. I don't know about how much the indigenous voices in Brazil come out in academia. And should they, or is that too threatening? Who is in control of the knowledge? Usually that's us. Are we opening our minds to actually including different voices? And we need to also confront the role of education in the past, which is like, it used to be used as a tool to make sure people thought the way that we thought, rather than the way that they used to think. And it goes back to what methods of research as well. So the research methods are usually from the global north, or in certain ways, are there different ways of getting information? And I'm saying that as a challenge. It is a challenge to us in the global north, in Southampton, to understand exactly, you know, what we do with this information. We just need to change a bit. And I would say that the process of decolonization is partly all of us, from student up to, you know, the academic leads in universities, to understand exactly what we are trying to do and where the power is coming from. There are different truths, and we need to, part of academia is working out what is a good truth, but what truth should we take? And education, and decolonized education, is rooted in the sense of place, about where we are. And that it could be in Sao Paulo, it could be in Southampton, it could be anywhere. And we need to be listening to those around, inside and outside academia, to understand how we're going to teach and produce an academic knowledge which is available to all. And we do need to reflect on our own characteristics. I do reflect on mine, probably too much sometimes, but I know I'm very privileged. I know that I am from the UK, I'm male, I am white, I am tall, I speak English, I'm speaking English to you now. You know, that is a very, oh, I'll go over there and just speak English. And I hate it, because why should you be listening to me speaking English? Fellow Inglés, but, or falado Inglés, maybe. And so I think if we reflect on ourselves, we can improve academic knowledge and, you know, and improve the research that we do as well. So I think I've basically said that. So the research that Southampton does is committed to ensuring that the research is co-led, strong partnership of mutual understanding. And I would hope that if partnerships between Southampton and Unifesp progress, that both sides would be able to say if that was not the case. And I think that trust in saying, look, you're being out of order here, if you're not doing things that are, listening, I think that needs to be said at every stage. And questions we asked, especially me, in this research, am I a problem or a solution? Do I need to be part of this project? And actually, sometimes, yes, because I can bring money. I wish it was as simple as that. But if I can just bring money, is that a good way to be part of it? And then we just need to make sure it's genuinely collaborative and that contributions are properly acknowledged. I know it can never be perfect because we are human, but I would like to think that we're working towards a more collaborative and joint research agenda in the future. And I will stop there. Sorry for going off on a political, front. So hope that was useful. Thank you very much.
Thank you so much, Amos, for your words. And it's nice to hear about decolonização. Alguém gostaria de fazer alguma pergunta? Ok, então...
How do you work with communication with very different cultures?
Not the language. I know you didn't mean the language. Language is simpler now because of translation software. It is difficult. It needs to be based on trust. And for me, it is simple to say that everything can be done remotely. But without going to visit, of course, most things need to be remote, but without going to a country and meeting people and understanding people and the different ways in which people work, you can't do that. This is where the agenda for partnerships comes in conflict with the agenda for climate change, because I do feel it needs people to go not just from UK to Brazil, it's Brazil to the UK as well. So you can understand people outside of the language, outside, and just communicate in a different way. It is not difficult to pick up body language, which is 80% of communication. But it's difficult to pick up that when you're online. And so I think visiting and talking and face-to-face is vital. That's what I would say. It's not really an answer but just listening and being honest. So, no.
Well, may I take that? So, Professor, thank you so much for your lecture, for excellent lecture. I think this theme is very important about all professors and postgraduate students. So thank you so much, and especially about the professors and the principal, the director of the Police School of Nursing. Thank you so much. Thank you for everyone in your home, at home. Thank you so much. Acho que nós podemos encerrar a transmissão. Muito obrigado a todos.